Hey guys, how you doing? So I just wanted to go over a topic that I got asked by one of my clients, and that is I've been told by doctors that I need to lose weight due to PCOS, polycystic ovary syndrome, but I've heard that it's harder to do so. Is that right? So when it comes to PCOS, we want to find out what exactly is it, what causes it, and then we can understand it a little bit better. So how we can apply it to ourselves if we want to lose fat, if you do have it. I just want to say, first and foremost, that I'm not a doctor. So if you want this information and to use it as advice, just know that it's generic advice. It's not necessarily medical advice. And if you feel as though polycystic ovary syndrome affects you or someone who's close to you and you want them to get the best care, then I would highly advise that they seek medical advice first. This advice is just generic based on how can you lose body fat if you do have it. So PCOS is a condition that affects how a woman's ovaries work. There are usually three common factors that are displayed with this. First and foremost is irregular periods. So this just basically means your ovaries do not regularly release eggs. The second thing is excess androgen, which is your male hormone. And there normally is an imbalance with this in females, which may cause physical signs such as bodily hair or actually excess hair in different areas like your face and body, for example. And then last is polycystic ovaries itself, which is essentially your ovaries are becoming enlarged and containing mainly fluid sacs in the body, and they're surrounding your eggs. So 1 in 10 women in the UK are affected, and over half of them display no symptoms. So it's just important to realize how common it actually is. And sometimes you may not even have these symptoms to actually realize that you do have it. So if you are concerned about it, just go to the doctors about it. But it's something that they'll be able to actually test and find out for you if you think it applies to you. There is no conclusive research and reason for cause of PCOS. Essentially, it can be linked to many things, but it's normally related to abnormal hormonal levels. It can also be related to your genetics, and it can also be related to insulin resistance, but there's nothing conclusive on this at the moment in time. So the big question is, when it comes to improving your fitness, improving your fat loss, improving your body composition, is how can I lose fat with PCOS if you do have it? Firstly, I just want to mention that if you do have it, it's something that isn't known to be cured. It can't be cured at this moment in time, but it can be managed, and the effects that you have on it can be minimized. So just know that it's not necessarily, a life sentence in that respect. It's something that can be improved and kind of managed and controlled. Losing weight does help, and although it is harder to do so, it's not impossible. So the basics will still matter when it comes to being in a calorie deficit, making sure that you are training enough. But we're going to go into a little bit more detail and give you a little cheat sheet for you to actually apply for yourself when it comes to this. So firstly, we want to touch on your diet type. As we know, fat loss, calorie deficit go hand in hand. That needs to be happening. So calorie control is always going to be the thing that you need to focus on. But then you want to favor a low carb, higher fat diet, which would normally be a balance of moderate amount of protein intake, a low carb intake, and then the rest of your diet is basically full of green and colored veggies. Those with PCOS usually have extremely poor insulin sensitivity. So it just basically means that they don't respond to dietary carbs that well. So you want to minimize that as much as possible. This by no means means that you should be focusing on keto diet or ketogenic diet or anything, or entering into ketosis. It's just that you want to limit the amount of carbs that you do have, dietary carbs that you do have, and maybe use them a bit more sparingly, maybe around your workout window, etc., because you'll be able to utilize and absorb those carbs in a better fashion. Training wise, you want to focus on progressive full body weight training 3 to 4 times per week. This is just simply because 3 to 4 times per week, I wouldn't advise any more than that, just simply because without proper recovery, it can create more inflammation on the body, and you're trying to minimize the amount of inflammation that is being on your body at the moment. So that includes your diet, but that also includes your training. The reason why we do encourage full body weight training is that it's a really effective way to increase insulin sensitivity, allowing you to process carbs more effectively and fat loss long term. So Do train hard, do train progressively for body weight training, ideally with load, because if you're doing, say, just resistance training or body weight training, then essentially you're going to be limited eventually. You want to actually continuously progressively train. So think actually gym training, lifting weights, etc., 3 to 4 times per week. Any more than that, then it might have a bit of a downfall, because you're basically not letting your body rest, and you're just constantly in this inflamed state. So that's not going to be helpful. Steady state cardio, it's pretty simple, really. 30-minute brisk walk in the morning is usually very, very good. It's a great way to control your stress and anxiety, which can help just mitigate any chronic issues or anything like that. And then same with HIIT cardio to training. You want to limit the amount of HIIT cardio that you definitely do. You would absolutely prioritize your training and steady state cardio and diet over doing things like HIIT. So I would limit things to about 2 times per week maximum, if that. You don't need to do any HIIT cardio personally. It's just that people tend to fall into the trap of doing HIIT cardio to burn more calories. And although it does have its benefit, it actually has more downsides when it comes to PCOS. So I would highly recommend that you try to minimize the amount of HIIT that you do overall. Carb timing, like I said previously, is just something to do with your ability to absorb your carbs. If there was a time that you were going to have carbs, if you were on a low carb diet, then post workout and before bed is usually the best times. Post workout is to basically absorb the carbs in the right fashion, so they're used as fuel to recovery. And also for your muscles. But then also when it comes to going to bed, it might help sleep and recovery in general, might help you go to sleep. So that's it. And then supplements, again, I'm not going to go into that as much. There's a list here, but essentially that is just a conclusive list to help minimize the amount of pain that you're in at the time, minimize joint pain or anything like that. And also just to kind of go over like inflammation and increase insulin sensitivity, which is what you want at the end of the day. So the goal overall is to manage your stress levels, your inflammation levels, and focus on being healthier, focus on good habits, and focus on ample recovery. That's generally it. It doesn't really change that much from those that don't have PCOS to those that do. But the main things that you probably would consider are your diet type, how you manipulate your diet. You still need to be in a calorie deficit. I wouldn't necessarily rush into being in an aggressive calorie deficit because you're trying to lose as much weight as possible. It's not a sustainable way for you to do that. And the chances are that you'll be on an aggressive calorie deficit for a short period of time, but then you'll crash and then go backwards. It's better to be in a more sustainable calorie deficit, eat as much food as possible, knowing that you can stick to this diet year round and it not have any damaging effects. So I would highly advise that you stick to a moderate calorie deficit, a conservative calorie deficit, tweak your diet so that it's low carb, etc. And then focus on good training progressively and then sticking with those terms in general.